endocarditis, the drug therapy of prosthetic valve endocarditis caused by Staphylococci, gram-positive bacteria. In the previous lecture, we seen the native valve endocarditis caused by Staphylococci. Now we will see prosthetic valve endocarditis caused by Staphylococci. The treatment plan for the Oxacillin-susceptible strain, we will see here Oxacillin-susceptible strain means the bacteria which is killed by the oxacillin or penicillin group and susceptible to the antibiotic. For oxacillin susceptible strains and prosthetic valve, if there is a prosthetic valve, we need here 3 antibiotic. First one is napsilin or oxacillin. Second one is rifampicin or rifampin, and third one is gentamicin. Now, napsilin and oxacillin, these are the first line drugs, or we can say anti-staphylococcal penicillins, the most commonly used, the first line drug. An adult dose is 12 gram per 24 hours intravenous, 4 or 6 equally divided doses, and duration of treatment 6 weeks or longer. Now, for prosthetic valve, we need the treatment more than 6 weeks and longer. Pediatric dose of napsilin and oxacillin is 200 mg per kg per 24 hours intravenous in 4 to 6 equally divided doses, and duration of treatment 6 weeks or longer. There is one comment: we can also use penicillin G as alternative if the strain is penicillin susceptible. But for the staphylococci, the anti-staphylococcal penicillins are napsilin or oxacillin. Both drug napsilin and oxacillins are effective in the same way. They inhibits the bacterial cell wall synthesis. The choice between the napsilin and oxacillin depends on the availability in the hospital, side effect, and patient tolerance, because oxacillin is responsible for the hepatic toxicity. So if the patient with the liver cirrhosis or increase in the liver function test, we need to give napsilin, but still depend upon the availability in the hospital. In the native valve endocarditis, we only used napsilin or oxacillin as the first line therapy. But for the prosthetic valve, we need 3 drugs. The addition one is rifampin. Adult dose of rifampin is 900 milligram per 24 hours intravenous or orally in 3 equally divided doses, and duration of therapy is 6 weeks or longer. Same. The pediatric dose for rifampin is 20 milligram per kg per 24 hours, intravenous or orally, in 3 equally divided doses, and duration of treatment is longer, 6 weeks or more. Rifampin inhibits the DNA dependent RNA polymerase and inhibits the growth of bacteria. Third drug is gentamicin sulfate. Gentamicin is aminoglycoside antibiotic. The dose for adult and pediatric is same, 3 milligram per kg per 24 hours in 3 equally divided doses, either intravascular or intramuscular. Duration here is 2 weeks. We seen before the treatment of native wall endocarditis caused by Staphylococci, and we seen there is the optional addition of gentamicin sulfate, but the duration is only for some days, not the weeks. So therapy of prosthetic valve endocarditis caused by Staphylococcus, and if the bacteria is oxacillin susceptible, then we need to add 3 drugs. The first one is napsilin, the second one is rifampicin, and third one is gentamicin. There is no optional addition of gentamicin. It's an compulsory NRG for the prosthetic valve endocarditis, and if the strain is oxacillin susceptible.